The number of seniors living alone who seek help from food pantries in the U.S. increased by 81% between 2006 and 2008, and the demand continues to increase. Catholic Charities USA reported a 54% increase in requests for food and services from seniors nationwide during the third quarter compared to the same period last year. I'm Duggan works at a food bank for New York City.
The fact of the matter is staggering unemployment rates, poverty and food insecurity are increasing across the nation, and all of the economists are predicting that those staggering unemployment rates
I don't have a political affiliation, I'm just looking at the...
It's very difficult for those of us who are on the front lines to understand what's meant by recovery and recession ending, because it's not ending anytime soon for the people we serve.
But it's just a hint to say, you know, in America we have issues of hunger. We do. And it's easy for us to turn
This Thanksgiving Eve, when most of us have family and food on our minds, an eye-opening report about the constant struggle to eat for senior citizens in the city. That struggle affects more than 1 out of every 3 seniors, according to a new city-funded report. Our government affairs reporter Melissa Russo is here with a story you'll only see on 4.
David and Linda, as you can imagine, most senior citizens are too proud to talk about this issue, and chances are you think it'll never happen to you, growing old and having to worry about food. But a new report obtained by News Channel 4 shows it is happening a lot more than we as a society might like to admit.
When I was young, I didn't understand, how life would be when I got older, because I was used to eating what I wanted to eat.
Marie Ash never dreamed that food would be a luxury later in her life, but here she is at age 75, and just like the years, her savings have gone faster than she imagined.
Some things, like I really need that I can't afford.
Marie was the only senior at her center willing to tell us on camera about her constant struggle for enough food, how she stretches her soups and eats just a third of her lunch so she can take the rest home to get through the weekend.
I eat a certain portion, at each meal. I've learned how to do that, to stretch things, You don't just sit down and just fool yourself up. Just eat enough.
The Council of Senior Centers and Services of New York interviewed more than 800 elderly New Yorkers in stores, food pantries, senior centers, and on sidewalks of 15 different neighborhoods. They found 35% are experiencing something called food insecurity, which means they worry regularly about having enough food, don't have enough money for food, or experience actual hunger. And remember, for many, that's after getting help from senior centers and local pantries. New York City's elderly population is soaring. 1.3 million New Yorkers are over age 60. They're living longer than seniors in the rest of the country. New Yorkers 85 and over are the city's fastest growing group. They're also poorer. 20% live in poverty.
That's 250,000 older New Yorkers live with less than $10,000 a year. I don't know how anyone even does it in this city. The other problem is if you can't cook or you can't shop anymore.
The report's recommendations: keep senior centers open 7 days a week, provide 2 meals a day instead of 1, improve access to food stamps, and a bolder idea: make Meals on Wheels for the elderly a right or a basic entitlement for the elderly, so there won't be hundreds of seniors on waiting lists like there are right now.
Why would you want waiting lists of 80-year-old people waiting for Meals on Wheels? I don't think anybody wants that.
We absolutely have to consider the idea of increasing the degree to which we give seniors food and moving in the direction of making it an entitlement.
Now, the Bloomberg administration did not comment on whether senior meals should be an entitlement, but Deputy Mayor Linda Gibbs pointed to $1 million the mayor just added to the budget this week for emergency food programs. She said no senior should ever go hungry and that the city would keep working to ensure that no senior does.
Melissa Russo, thank you very much. The Broadway...
So guys, what I say to you, you're going to be the future RNs, future leaders. We need to pay it forward. I love that movie's title. One small thing that we can do. What an interesting concept to actually say Meals on Wheels should be a right for all seniors. What an amazing thing. What if we started a simple campaign to do that for here in San Antonio? We don't know how many of our seniors are doing the things that that lady depicted in that newscast. It goes on all the time. They might choose cat food instead of human food to eat because why? They've got to pay, they have to pay out money, a certain portion of their money for their medications. Some of you guys have already been to the nursing homes. You're already doing these care plans. You already see the number of medications. Now those are individuals that are in the nursing home. Do you know that that's not where seniors go? That's just a small percentage of our senior population. Most of the seniors are out in the community living in their homes or their apartments. They have no families, no family members that can check on them. They live maybe in isolation. One of the biggest things, and they touched on it in the newscast, was that as the seniors grow older, they become incapable of transportation and going to buy the groceries. I tell you this, when I did the health promotions clinical, and I worked with a church entity, which we'll do in the next quarter, and I'll have 10 of you guys that's in this room, whoever's going to do it. You got to meet certain qualifications. Everybody's got to have a laptop, and they've got to have the ample gas. Everyone's got to have a car that works and not afraid to spend some gas money. So that's for this. It's a particular clinical where they go out and they visit these seniors and in this church, the members. But some of them, their biggest concern was they don't know how to get themselves, because they've gotten so frail and elderly. So they're elderly already. They're in their 70s, 80s. Some of them's in their 90s. They don't have a way to get themselves transported to go shopping. It's a challenge. And then think about somebody that's in their 80s and they're frail, with the struggles it would be to go shopping and it's a challenge. They're frail already. To carry those groceries from wherever they live, maybe they're fortunate they live in an apartment. It's a 2-story apartment maybe, and that's all they can do is get themselves up to their apartment. A lot of them may live on the first floor, right? Because they have walkers. People that live in the community, they're not too far distance from those you're seeing in the nursing home, you see. You have to realize that that's what's going on. That's what's going on in your neighborhood. You guys could adopt and organize. You know how they have the safe neighborhood watches? Why can't it be something tied to watching over your neighbor in terms of nutrition? Are they in need of something? Take it a step further. I'm just throwing ideas out there because you guys are going to be the leaders, Y'all are the leaders of tomorrow. And that's basic. That's Maslow. Maslow, the essential elements is oxygen and food and water and shelter, right? Mm-hmm. That's what I'm trying to say. We need to initiate something. And you'll find that Wayland, that's one thing that, which I'm very pleased, Dr. Frazier, she really likes when we start engaging in community initiatives, and we do some volunteerism, and we do some service learning, and some of the things that my students have done, they've worked at the food bank. They're taking a clinical day, and that's what we did. We've gone to Haven for Hope. And even I was chopping the lettuce, you know, things like that. But it makes you, as the future leaders, appreciate what we do have. And I will tell you this, I will say this. I've had, in my teaching, since I've been teaching, I've had students that have come up to me because I guess I am approachable, right? And they'll tell me sometimes, this was at another school I was at, they said, I have 3 kids and I don't even have a can of beans in my cupboard. And I said, let me take you to this equity center. And then I said, well, I'm just going to get a box together. But we do stuff. You see what I'm saying? We don't know who might be in that need. And I'm not trying to step on anybody's toes here. I have no idea. But I say to you guys, you look out for one another. You're in this program together. You help one another. And by helping one another, you're going to help your community. So you keep a pulse on yourselves, but also be aware that we can do things to help our own community. I love the idea about the Meals on Wheels for all seniors. Mm-hmm. Let them have that option. Maybe they don't need it, but if they don't need it, then that's fine. But let's let that option be for all seniors. Because I can't tell you the concerns that having to, and here in San Antonio they do have a program, and you'll see, I think they used to have a sign, a little banner out here close to on this side of the parking lot. Need help with delivering meals? Can you deliver meals at your lunchtime? You know, something like that, where they need help just delivering meals. You know, they might be able to package them, but see, then getting them out to those seniors. You see the logistics involved in these undertakings. So I don't think it's no better higher calling that because as nurses, what we are concerned about that Maslow's basics. If we can't have food, can we survive? No, none of us can. Malnutrition, it's abundant. And it's not just in seniors, it's, you know, we hear about children. And they've started, of course, that campaign, No Kid Hungry in America by, I don't know if it's 2013 or 2014. They've started a major campaign that's been ongoing for about 2 years now, a big push. I talked about lab values earlier, and of course my clinical group, we're going to all bring our lab manuals. Because what I really want y'all to do, and you've got to understand what I'm saying here, as you progress in this program, you're going to go to Adult Health 1. That's third quarter, isn't it? Adult Health 1. That's next one's going to be Health Promotions and Health Assessment. Yeah. And the third quarter, Adult Health 1. And I am telling you now, guys, you want to have a very good understanding of how lab values equate to your specific patient. I'm telling you, you've got some instructors in that Adult Health 1 that they're going to ramp it up big times. I'm telling you this. And I'm telling you, you need to get a very good understanding of lab values and what do they mean as it relates to that patient's condition. I have a patient that comes in They found them at home. Code 3 comes in. They were found on the floor. They had fallen and fractured their hip. They come in and of course they have to do surgery. They're frail. They're about 5'6" and they weigh about 110. Frail elderly. They do their labs and they find that they have very low protein, very low albumin. They have elevated BUN creatinine, and they have low hemoglobin. Their hemoglobin levels are low. Those point to, number one, malnutrition. Number one. Because you look at the whole picture of that patient. Don't just look at your lab manual and say, oh, it could be this or that. And some of you guys got your care plans back from me, and I said, well, but what else with this patient? So you looked at your textbook and you saw a definition of something, and you put that in there. But that really isn't what we're looking for. We're looking at how does that compare to your patient that you took care of in the nursing home. Now let's look. Let's think about your patient and these labs and how are they congruent? Can you, with poor labs like those, you can almost paint that picture of that patient that I just told you about. That person is going to have surgery because they fractured their hip. Are they going to be able to heal faster or slower? Slower. When you have these offsetting lab values, they heal slower, they're more they're more susceptible to immune disorders, sets them up for more optimal infections, right? So I want y'all to all, is that the lab manual? May I hold this up? You see this book, guys? Mm-hmm. Y'all want to embrace this book. If you'll embrace it now and try to understand your patients that you're taking care of now in the nursing homes, of why you're seeing the lab values you're seeing, whatever they might have in their chart, then you'll be that much stronger as you progress in the program. Do y'all see what I'm trying to tell you something, right? Be ready. Be ready. Yes.
Should we keep all those?
Yes. Please don't give up your books.
No, some of that. Keep going.
Yes. Love your books. I still have my LVN book, my Lippincott Med-Surg book from LVN school 1983 to 84.
You ever look at it?
I still have it. I see it in my, I have so many books now. I have so many books that my husband, I have, like, you've seen the show Hoarders.
Mm-hmm.
Can you
don't be like that. Don't be like that.
Oh, yes.
Don't be like that.
The living room, and it's nursing books, you see. I can't let go of it. I said, no, I'm not ready. I can't. He said, when are we going to? I said, I'm not ready yet. That's what I say. I cut him off. I don't even let him finish the sentence because I know where he's going with it. No, you wish to keep those books.
Another question. Are these going to be texts that are going to be required for the courses? Are we going to be buying?
I would definitely keep that lab. If you needed to sell, the one I would hold on to is if you have your care plan book, hold on to that one. Hold on to your drug book. Hold on to your tapers. If you got a medical dictionary, if you did, I don't know.
No, we didn't. That wasn't on the list.
Well, I don't know what, And this lab book, I would hold on. I'll be honest. I don't know. The fundamentals, it brushes over quite a bit, doesn't it? It's sort of over, and it makes sense that the fundamentals would be that way, because we're just trying to keep you in. You see, we have those that have been working for the past 5 years at Whataburger. they've never stepped foot into any kind of medical thing, you see, let alone nursing home. They've never even stepped foot into a hospital. They've never had a family member that's been in the hospital. We're just trying to say, we're trying to keep you in the profession, in fundamentals. So we'll brush over quite a bit of things. And you note that this book is sort of a brush. It's not in depth, is it? It doesn't go into disease states in depth, does it? So maybe that book might be, but I'm not saying, because this is not Ms. Alexay's course, and I'm on YouTube here, right? But that Med Surg book, you know, when you get in your adult health 1, adult health 2, your critical care, that's your adult health 2, definitely hold on to those textbooks. You have your ATI as a good resource, but that lab manual, that's going to follow you throughout. You want to open that up every week and analyze the patient that you're taking care of and see how nice that care plan, it makes you do it, doesn't it? There's a lab section. It says pertinence to client. And it's not pertinence to what that book says. You've got to think a little bit. It might give you definitions, but you've got to then take that and excrete it and say, now how does this pertain to Mrs. Jones that's at Alden Wynn? What did I see about Mrs. Jones? And then this is the labs that she had. You see what I mean? You understand? You've got to make that transition. You just can't take everything point and blank from a textbook. Because I could tell you that last quarter they had Potter and Perry textbook. You see what I'm saying? For fundamentals, different publisher. And every publisher is a little bit different in what they focus in on. They also do a brush over, but they have a slight skew of what they focus in on. But what I will tell you is patients are patients are patients. And you guys, that lab manual, get you a good care plan book. I will tell you right now, this is what they have here. This is an okay care plan book. You can use this, right? That's a good care plan book. I know of also another one that's a good one too. All or Nothing. No. That's the lottery game. All in One. I played it this weekend. Of course, lost. All or Nothing. I just like the name of it. All in One. All in One care plan book. That's bad. That's on that YouTube. Man, I'm gonna have to. That might have. You'll have to do some edits.
Yeah, do some edits on it.
I emphasize the lab manual, guys. Please take that time to think about whatever resident that you choose, and then go read about those particular labs, and then think about your patients, what kind of disease, medical diagnosis that they have. Why would that be significant? A patient's got COPD and they have a high RBC. Maybe there's clumping. Maybe you're seeing some clumping, you see. Because why? As a COPD, a person's having problems with breathing, what are they needing? They're needing oxygen. Their drive is off their CO2 levels. Things like that you haven't had, but you're going to. We're just giving you brushes of things in fundamentals because we're introducing you to lots of things. But that lab manual, you keep that. You might want to keep that one actually in your practice. See, you always carry your drug book with you to clinical because you might, some of you have the situation where you can't actually will be able to give meds. But you want to always know what meds they are. You want to know what they're for, you see. I don't tell my students memorize meds. I won't tell you to do something I can't do. I'm not a computer. I can't tell you about other instructors. Sorry. But what I will tell you is what we have are resources. We have what they call the drug books. We have the ATI electronic drug book. You see, I just want y'all in preparation for boards to do drug cards. I have a reason because I want y'all to succeed on your boards. I want you to pass the first go round. And we realize that if you write the drug cards, if you write the drug card with your hand, there's some part of your brain that keeps that. Because anybody can buy a box of drug cards at Barnes & Nobles and hand them to me. Hand me 5. You see? What good does that do you? You hand me those 5, I say, okay, there's 5, so let me give them back to you. You take those 5 drug cards and you stick them back in the box. And that's where they sit, nice and neat in the box. People don't pull them out. Some people do, but a lot of people, because you got so many things on your plate. So that way, by making you write out these drug cards, and you can use whatever size. I just gave you a sample, but you can, if you need to get 5 by 7s, I don't care. Right front and back. It's whatever works for you. Just trying to help you remember. And I can say that if you'll know all those drugs, but in 2 years, if you can have an understanding, not have everything memorized, but an understanding of those drug or those drugs that are listed on ATI, I think you'd fare very well if the roulette wheel stopped on pharmacology. It's going to be the focus of your NCLEX exam. You see what I'm saying? I don't know how some people it falls on med surg. Some people's exam falls with the focus on mental health. It's a roulette wheel. It's electronic. They push a button. That's how it is. Some of it falls, and I will tell you, on infection control. You guys make sure you have a good handle before you walk into boards about infection control practices. What type of equipment do I wear for this type of condition? Now, I've said it, and it's on YouTube. I've warned you Q1, right? You've got 2 years to get that together. I've had a student that just emailed me this weekend, and she told me, tell your students to make sure they have a very good handle on infectious control practices. Does this certain disease warrant to have the door open or shut? What kind of equipment do I wear when I go in to take vital signs if I'm not going to be exposed to any bodily fluids? What kind of utensils for the meals? What is the practice? Do I let them have a regular fork, or do I give them a disposable utensils for this particular condition? What do I do? How do I handle when a patient has to leave the room and go for a test? What is the proper procedure? I tell you this because it's very important. It's not just important for boards, but you will actually have it in your everyday practices in the hospital. And now it's on YouTube. I told you about that lab manual, right? You guys will acknowledge that I have told y'all to be looking at that lab manual, right? Mm-hmm. Yes. 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 See, and that's on YouTube because some of you said yes. So don't say that, oh, we didn't have this in fundamentals. I've told you, you've got the book, you've got to apply it with your patients that you're taking care of in the nursing home to understand. The more you understand now with the basics, it's just gonna, all it does is you build on it as you go through the progress in the quarters. You see what I'm saying? Okay, I'll get off the soapbox. Healthy People 2020. promote health, reduce chronic disease associated with diet and weight.